Welcome back to our dialogue on diabetes as we get more in depth into the research and what's new in the world of medicine when it comes to diabetes. Joining us now is Dr. Henry Rodriguez and Dr. Denise Edwards. Please tell us what areas where you specifically work at USF's Health Center.
So I guess I'll start. The USF Diabetes Center is on the USF campus. It's in northeast Tampa. And the Diabetes Center really provides education for all individuals with diabetes, both type 1 and type 2, and I know we'll probably discuss that in a little bit. But our clinical practice really focuses on those that require intensive therapy. And we're doing quite a bit in terms of clinical research looking at type 1 diabetes and actually type 2 diabetes in children. All right.
And you're in a whole different area?
A different area. So I'm in South Tampa, which is at the Diabetes Home for Healthy Living, which is was created as kind of a one-stop convenient place for adults with diabetes. So they can have all of their testing done, blood work done on site, metabolic testing, they can have their eyes scanned, and kind of do everything all in one stop rather than going to multiple places.
Because as I'm learning, diabetes is something you have to stay on top of. You don't just get diagnosed and say, okay, here's the routine you do, put some insulin in and you're good. It's
if only.
If only.
Right. It's frequent monitoring, it's checking other body parts as well and other organ systems.
Okay, because as Teddy mentioned, it affects every area of your body for the most part. Explain the difference between type 1 and type 2.
So, you know, you can go into a whole lot of depth, but when it comes down to it, people with type 1 diabetes lack the ability to make enough insulin to control their blood sugar. And unfortunately, the only way that we can replace insulin is by injection, either through a syringe or an insulin pen, as he had mentioned, or an insulin pump. Individuals with type 2 diabetes typically can manage their weight, as Dr. Edwards will speak to, and their lifestyle. And in some cases, that alone can help control their blood sugar. If they're not successful with that approach, then they can use a number of oral medications, pills, and some injectable therapies. And if those are not effective, then they turn to insulin. But, you know, from the patient's standpoint, the biggest difference is if you have type 1 diabetes, as he mentioned his child does, the only therapy that's going to allow them to control their blood sugars is insulin by injection.
Who's most likely to get type 1 or type 2?
Type 2 can really be any age. It was typically considered adult onset, but we are seeing more and more young people, children and teenagers, that are getting type 2. Type 1, you know, in the past was called juvenile diabetes and thought to only be seen in children, but we are seeing more young adults that are developing type 1 diabetes as well.
Is there a test? I know it can run in a family history, but is there a specific test you can take?
Well, certainly we always look for symptoms, and Teddy had mentioned that, in terms of the frequent urination, the unexplained weight loss, particularly in the case of children who really shouldn't be losing weight as they're growing, and then, you know, the thirst that results from the frequent urination. For type 2 diabetes, you know, the test is a blood sugar. You can do a hemoglobin A1C, which reflects their average blood sugar over the prior 3 months. For type 1 diabetes, again, it's a blood sugar test. Many times children will go to their pediatrician with a complaint that, you know, perhaps they have a urinary tract infection or something like that. They can check their urine. If there's sugar in that urine, it certainly suggests that they may have diabetes. With regards to risk determination, I mean, we're part of a global research network looking at screening family members of those that have type 1 diabetes to see if they have markers in their blood that would suggest that they're at increased risk as well.
You mentioned screening. Do you work with other corporations or universities, rather, or research centers who are doing similar things to what you're doing?
So there are a number of type 1 studies that are actually coordinated through the university. The one that I've been involved with actually since its inception in 2001 is called Type 1 Diabetes TrialNet. And it's a global study looking at screening people that have a family member that has type 1 diabetes, and then if they are found to have those increased markers or antibodies that people with type 1 diabetes have, then potentially they're eligible to participate in some prevention trials that we're looking at.
Okay. And is there any latest research that you can tell us about or hopeful predictions on the horizon?
Well, I think there's a lot of encouraging work, and you know, sometimes people tend to categorize research that's going to benefit people with type 2 versus type 1. From my perspective, if we can find a cure for type 1, it's going to benefit people with type 2, and things that Therapies that are currently being used in type 2 diabetes are now being examined to see that they might benefit people with type 1 diabetes as well.
Okay, all right, that's very interesting.
And there's more and more exciting medications that are coming out for type 2 diabetes, which are very different than the older medications, and also are helping with weight loss, which we know is a big factor with type 2 diabetes as well. So there's some good things on the horizon.
That's interesting. Medical marijuana could be legal here in Florida this time next year. Are you doing any research that would give you any ideas of how maybe your patients would react to medical marijuana?
Well, I think we probably speak for both of us. We're currently not doing that research, but I will kind of provide a note of caution, so to speak. You know, there have been some studies that have suggested that a component of marijuana might be beneficial in controlling blood sugar, maybe even resulting in weight loss. But if you look at the use of medical marijuana, you know, what we're talking about is a derivative of, you know, the naturally occurring substance, and if it's not something that I think any of us in the field right now would recommend.
Okay. All right, very good. Doctors, any words of advice as we close out the segment for someone who might think they have diabetes?
Just like it was mentioned earlier, just go see your doctor and get checked. It's pretty simple testing. It's a very manageable disease, but the earlier you find out if you have it or not, the sooner you can get on top of the treatment, and the more you can prevent any long-term complications. Okay.
And a center like yours can educate them on what they need to know. And they don't have to go into a doctor's office, right? Makes it more of a home environment?
It's not meant to feel like a doctor's office, so it is more of a comfortable environment. They can come in, you know, feel as if they are not in a doctor's office and have everything done all at the same time.
Very good. Well, thank you both for the research that you're doing at USF and helping a lot of diabetics here locally. Thank you both.
Thank you.
Thank you. All right. Coming up next, we'll be right back, and we're going to show you how a former Miss America is changing the lives of local teenagers living with diabetes.